Nursing informatics is really the application of technology and computers.
Using technologies, we can really deliver better patient
Nursing
care.
informatics
We can
is
connect
being that liaison
clinical
between
experts
the
and
technology-savvy
technical experts
people
to
and the
develop
clinician
better
and their workflows.
Nurses have to be at the center of technology and healthcare as well.
What is nursing informatics? With this video, may we all be informed what nursing informatics is in the hospital, the academe, and what it contributes in the pandemic.
Nursing informatics in clinical practice. The tech advancements offer more in terms of being the way of how professionals work more efficiently and productive. Like in clinical practice, technological advancements helps in a form of informatics. One of the primary ways that informatics has changed nursing practice is through documentation. Gone are the normal days of charting that had to be meticulously updated with handwritten notes. Today, nurses are more likely to input notes into electronic health records and other systems that keep a patient's medical history up to date and easily accessible. The healthcare information and management systems in society reported that as the result of electronic charting, nurses are able to obtain information quickly and efficiently, using the information to improve the daily workflow. Storing the information electronically is more easily available to all members of the care team, including physician and other care providers as well as staff. But informatics is also an important part of care coordination in nursing. The ability to track staffing, workflow, and communication can help nurses to identify areas where current processes can be improved. This can also help ensure staffing levels remain adequate, which is critical for providing patients with the best possible care. If the nurses to patient ratio drops too low, patients are more likely to suffer adverse results. Maintaining adequate levels help nurses provide the best possible care each day without burning out. This evidence-based practice have long been an essential part of nursing. Today, determining those best practices involves the use of health informatics, analyzing the mass quantities of data collected regarding the patient care and outcomes helps to determine how the best to treat these conditions and situations in the future.
The role of the nursing informatics to the academe. Thanks to the continuous technological advancements, it has been easier for students to learn skills in rendering nursing interventions to clients. One of the most important nursing informatic advancement was the development of medical simulator robots. The medical simulator robot enables the users to train different procedures fundamental in nursing education, from taking vital signs, taking care of a feverish patient, to even monitoring progress of labor and actual handling of delivery can be honed through the use of these robots. With the advancement in the nursing field seen in the recent years, the procedures and roles performed by the nurses have become much more complicated and diversified. In order to secure the quality and safety of medical techniques performed at medical, nursing, and nursing care scenes, acquisition of higher clinical skills and objective assessment have become essential for those health professionals, including students, doctors, and nurses. As a result, apart from the traditional classroom lectures, education involving practical trainings utilizing simulators has been drawing more and more attention. In order to meet the needs, simulators are developed with a realistic appearance, internal structure, and biological reaction to make the practical procedure as real as possible. The simulators enable the user to repeatedly conduct trainings with a human-like touch, sense, and reaction, which will ultimately improve nursing techniques. It also provides opportunities to evaluate newly developed equipment to provide more secure and safe nursing care.
This pandemic is obviously a challenge for all of us, especially on third world countries with collapsing healthcare system. Needlessly to say, Philippines lacks the resources to have adequate information and knowledge about the COVID-19 virus. To connect with the countries with the funds and enough resources for research and instruction, nursing informatics is an essential. National Library of Medicine's current focus is in novel approaches to information delivery. text messages, PSAs or public service announcements, and new types of billboard advertising are happening to link to a community, identify where resources are, and connect people to services as quickly as possible. As the future unfolds, nursing informatics plays a key role in creating a virtuous cycle and ensuring it is valuable to patients. Application developed in response to the pandemic was also a great help. China, at National Yang Ling Chiao-tung University, QR codes are located at the entrances to all buildings for faculty, staff, and students to scan using their smartphones. And the university can track a mobile user's body temperature, testing status, and quarantine history, all monitored real-time. The Brazilian Ministry of Health meanwhile developed an online chat, a hotline number, and a WhatsApp channel to facilitate communication between patients and health services, minimizing risks of exposure. Here in the Philippines, Stay Safe is the Department of the Interior and Local Government or DILG and IATF or Interagency Task Force on Emerging Infectious Diseases official contact tracing mobile app in the Philippines with Google App Exposure Notification or GAEN. In the app, you should enable your Bluetooth to activate the GAEN feature. Once you turn it on, a random ID is generated by the exposure notification system in your device. Your device will be periodically checked random IDs associated with positive COVID-19 cases against its record. Should there be a match, you will automatically receive exposure notification and useful instructions from DILG. Information about who you have encountered using the GAEN feature will never leave your phone and is automatically deleted after 14 days. With this, nursing informatics is not the future. It is today that we need to be informed.